Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff. Welcome back to Anatomy and Physiology on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to be discussing an event that can happen during cervical flexion, really at the atlantoaxial joint, and it really relates to the integrity or lack thereof of the transverse cervical ligament. We'll talk about what this ligament does in just a minute, but before we do that, we really should understand some of the basic biomechanics of the atlantoaxial joint. Hopefully you remember from previous videos that the atlantoaxial joint provides over half of the rotation of the entire cervical spine, so it has a huge rotary component. And really what's happening is the atlas, or the C1 vertebra, is rotating about a stationary axis. Okay? The atlas rotates about the axis. That's actually why the axis is named as such. But we're not talking about rotation here. This is going to be an arthrokinematic movement about the atlantoaxial joint. So to set the stage, we've got an individual here who's in cervical flexion. So they're bending their neck forward as if to nod yes. And we know that there's upsloping at each segment here in the cervical spine, particularly in the lower cervical spine. But if we look at the atlantoaxial joint, what happens is as we go into cervical flexion, the atlas is going to translate anteriorly relative to the axis, or C1 pivots anteriorly relative to C2. And the reason why this anterior pivot of the atlas on the axis is so minimal is because normally we have an intact transverse cervical ligament. If you don't know what that looks like, don't worry. We're going to look at it on the next slide and get more detail on that. But it restricts that movement, so it's very minimal in normal cervical flexion. And you don't need to know anything else about it to answer this following question. What would happen if the transverse cervical ligament were damaged? Well, if it normally restricts anterior pivoting of the atlas on the axis, if this ligament's damaged, then we should see excessive translation or excessive anterior pivot of the atlas on the axis. And that's exactly what happens. And there's several conditions that can happen where the transverse cervical ligament is damaged. It can be an acute trauma, such as a motor vehicle accident. Also, more chronic things like rheumatoid arthritis and even Down syndrome, those are associated with damaged transverse cervical ligaments. Okay? Obviously, these last two occur more chronically and slower than acute trauma. Okay? But you would see excessive translation of the atlas relative to the axis. So now we'll see what this looks like in detail on the left here. Don't even look at the right yet. We're just looking at the left. This is what the normal anatomy looks like. So this vertebra right here we're seeing, this is the atlas. This is C1. We're looking at a superior view. So these right here are the superior facets that house the occipital condyles of the skull. Here's the posterior arch, and here's the posterior tubercle. So back here's posterior, out here's anterior. Now this bulging structure that's sticking directly upward, so it'd be coming out of the screen toward you, this is the odontoid process of the axis, or the dens of the axis. So remember the axis, or the C2 vertebra, has this bony projection that sticks directly up. So that's the dens, or the odontoid process. And it makes contact with the posterior part of the anterior tubercle right here of the atlas. Over here we have the alar ligaments. These restrict contralateral rotation. And then right here, where I'm tracing my mouse, this is the transverse cervical ligament. Notice it goes from one side of the atlas over here, really near the lateral mass. It goes around the dens and then to the other side on the lateral mass. That's the transverse cervical ligament. And what it does is it really keeps that dens in close contact with the anterior part of the atlas, so that anterior tubercle. Okay? So when we go into cervical flexion, there is a little bit of anterior pivot of that atlas on the axis, but it's kept minimal by the integrity of this ligament. Now, what does that mean? Well, if the atlas is going to translate or pivot anteriorly, imagine this anterior tubercle is going to go a little bit up, okay? Just a little bit. And as long as that transverse cervical ligament's intact, this atlas should not go that far anteriorly. It really shouldn't. It should remain in pretty close contact with the dens. Why is it important that that dens remain in contact with the anterior tubercle? Because look what is directly posterior to the dens. This is your vertebral canal. What's in the vertebral canal? You can see it right there. That is the spinal cord. You might already be able to guess where this is going. Now, let's look at the pathological state where the transverse cervical ligament is damaged. You can see it damaged right there. Notice the alar ligaments are still intact, but the transverse cervical ligament is damaged. Now, the way I'm showing this is I'm lining up the dens on each side, because technically it's not the dens that's moving, okay? It's really the atlas that's moving. Remember, when the transverse cervical ligament is damaged, we get excessive anterior translation of the atlas. So notice the atlas, relative to this dotted line, has translated anteriorly more. And that's because the transverse ligament is damaged. Why is this so bad? Well, this is one bone, the atlas. So if the anterior tubercle moves anterior, the posterior tubercle moves anterior, and since the spinal cord has to remain within this vertebral foramen, the spinal cord also moves anterior. But the spinal cord can bump into the dens because the dens doesn't move. This is purely an excessive anterior movement of the atlas. The dens isn't moving. So that means that as the atlas translates anteriorly, it brings the spinal cord with it, and it can compress it into the dens. This is called spinal cord impingement, or more specifically, a myelopathy. And myelopathies produce all sorts of upper motor neuron signs. We'll talk about those in future videos. But hopefully this video gave you a good foundation for the function of the transverse cervical ligament and what happens when it becomes compromised. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you.